Hi, my name is Mpoma Taung and I'm very excited to be here. I'll be one of the facilitators which will be taking you through our COVID-19 club training manual and going through various sections with you. As I start, I'd like to take you through section 2, which is just an introduction to you about the general information about the virus or the disease. So we'll go through in this section and look at symptoms of the coronavirus. What must you look out for? If you feel this way, does that mean that you have the coronavirus? We'll look at people who are also at risk, and we'll also give you some of the preventative measures or some of the things you need to do to ensure that you do not contract the virus. Now, just to give you a bit of a background, that in December 2019, the World Health Organization received numerous cases from a city in China called Wuhan, that there were a number of pneumonia cases and a lot of people were experiencing this. The first date, however, was confirmed on the 7th of January 2020 that this virus is actually called the coronavirus. Now, in saying that, I personally have a friend who lives in China and they are currently studying engineering, and they will be done by the end of September this year. And I remember it was around 9 o'clock, 9:30, when they called me and they told me that they've been advised never to leave the university, never to leave their boarding rooms, because there's been an outbreak of a virus in China. And little did I know that they were actually speaking about this virus called the coronavirus. And here I am also today trying to study it, trying to obviously understand it better. However, I believe that everybody is aware now of this pandemic that is happening around the world. In saying that, I'm just going to give you some symptoms that one needs to look out for to ensure that they have not contracted the coronavirus. So let's ask the question, what are some of the symptoms that one can look for in terms of ensuring that they are safe from the coronavirus? Symptom number 1, when you experience fever. When your temperature is above 38 degrees, body temperature, then you must know that this is probably a symptom that you are exposed to the virus. Now, just to give you a little bit of information, in children, the temperature must not be above 38 degrees. In adults, 38 degrees as well. Now, all the people who are older than 70 years old must not have a temperature reading of above 37.8 degrees. Some of the other symptoms that I can give you is when you have a new cough or a cough that is getting worse and it becomes a dry cough. The other symptom is difficulty in breathing. Another symptom is consistent tiredness. And another symptom that we can also look at and say that this can also be a sign of the coronavirus is if you have a sudden loss of smell without the congestion in your nose and without a stuffy nose. Now, what are the more lesser symptoms that one can look for? So there are symptoms, but there are also symptoms that are there, but they are lesser than what we have just described. Some of them can include aches and pains, a sore throat, constant diarrhea, conjunctivitis, which is also called the pink eye. When you're always rubbing your eyes, they are in pain, they are burning, you're always scratching them, they are itchy. That's one of the signs that you can probably have come across somebody with a virus and you are experiencing that. Headaches are also another one, and then a rash on the skin, or when you lose some sort of like a color, discoloring on your fingers and your toes. So that is when you need to be able to look at yourself and say, wait, I need to be checked up. Now, just to give you some bit of information to say that COVID-19 affects different people in different ways, because all our bodies are different and we all react to viruses and various diseases differently. So most infected people will develop mild to moderate illnesses and recover without going to hospital. I personally know of somebody who had the virus, but and actually they went to work, a nurse, and they contracted it from a colleague, and then they were quarantined and self-isolated for 14 days. But through the 14 days, they said they never even felt a sign, not even a single pain. So that's how the virus operates. We are all different people and we all react to this virus differently. Now, who are the people who are at risk and can die from this virus? People with weak immune systems. What do we mean when we say that somebody has a weak? For example, if you have digestive issues, if you have a loss of appetite, if you have things like diarrhea, abdominal cramping, inflammation of the internal lungs or internal organs, that is somebody that we can say has a weak system, and such a person can easily be exposed to the coronavirus, be hospitalized, and not end up making it out of hospital. People with chronic diseases. What are some of these chronic diseases? When we look at people with diabetes, heart or cardio problems, lung, kidney diseases, some of these people and other chronic diseases are some of the people that are at risk in exposing themselves, or if they contract the virus, they can be hospitalized and not come back from hospital. People over the age of 70 and older are also another group of people that are at a high risk when it comes to contracting the coronavirus. Now, anybody can be tested for the COVID-19. We are all aware that government have set up screening clinics, assessment clinics, mobile clinics for anyone who needs to be tested. And I would encourage all of us to actually do this. Go and screen yourself, go and get tested if a need arises, or if you have come into contact with somebody that has the coronavirus. And all these must be done according to the public health regulations. So let's just not get up and just go and say I'm getting screened or I'm getting tested. But please make sure that you go to a place that is regulated, a place that is safe, a place that you know that they have the right equipment and the right personnel and the right staff to be able to test you for the coronavirus. Now, we are all also aware that DISCAM, for example, have been providing testings for a number of people nationwide, and they actually try to make life easier at times for other people, so that you can come through with your car and then you don't have to be exposed, and they can test you there. Also, we also realize that there are two types of testing that one can do with regards to the coronavirus, or to test for the coronavirus. One of them is called the viral test, and another one is called the antibody test. What is a viral test? The viral test tells you if you have a current infection, and the antibody test might tell you if you have had a past infection. So these are some of the tests that can be done and that are available. Now, with regards to the treatment of the coronavirus, is there a treatment? The answer is no. There is no specific treatment or a vaccine. And as we are speaking now, studies are currently going on and on and on. Should you contract the coronavirus, the only thing that has been advised for us to do is to go into self-isolation or quarantine yourself for a couple or a number of days. And that's how you are going to be better and ensure that you don't also carry the virus through to other people. How is the coronavirus contracted by us as people? Now, the coronavirus can be contracted in the air when a person who is sick sneezes, talks, or coughs. That is a person that actually has the virus. It can be contracted through the spread of you not washing your hands, and then you go and you touch your mouth, your nose, you rub your eyes, or you touch an object or a surface that has the virus. Now, the coronavirus does not survive for long on objects, but studies have also shown that affected areas which are not in very high humid places can leave the virus to be there for some time. For example, it has been discovered that the coronavirus stays for 4 hours on a copper, 24 hours on a cardboard, that's a day, 48 hours on a stainless steel, and 72 hours on a plastic. And hence it is advised that whenever you go from a place to a place, you must always sanitize your hands, because you don't know what you are touching. You might touch the surface and there's a coronavirus, and then you come and then you don't sanitize. You are busy scratching your hand. You are touching your your mouth, and then you're touching your nose, you're rubbing your face, and this can lead to the contraction of the coronavirus. So all these are advices that the health or the World Health Organization is providing to us so that we can be able to stay away from these viruses. I'm sure you are all aware now that almost in every place where you go, when you enter, you sanitize yourself, you wear a mask, they check your temperature, you write your name. So these are some of the things that can help you to not get the virus. Now, just in closing, I just want to say, these are some of the health recommendations that have been given by the health organizations around the world so that one makes sure that they don't contract the disease. So I'll give you a couple of them. So as we can go through them, first of all, they are saying that you must wash your hands for more than 20 seconds daily and regularly. All right. Number 2, they are saying that you must use alcohol-based, which is alcohol-based 70% sanitizer if you don't have a soap and if you don't have water. You must cover your nose when sneezing or your mouth when coughing to reduce the spread of the germs. The other thing they recommend is that when using a tissue, you must get rid of it or dispose it as it was if you have used it with your hands. The other recommendation is that if you are sick, you must avoid contact with people who are sick, or people who have a weak immune system, or people who are older than 70 years, and people who have all these chronic illnesses that we have mentioned. One of the things that has been advised according to the health departments is that you must avoid direct contact, such as shaking of hands, giving hugs. Find another way of greeting, like we all do, greet with the elbow. The other recommendation is that we must keep social distancing and wear our face masks and cover ourselves when we are in public places, because we don't know what virus is moving around there. And lastly, one of the recommendations is that we must limit our traveling as much as possible. It is good to travel, but you need to make sure that when you travel, you are safe. You've taken the necessary precautions by doing screening, by checking yourself as you go and as you come back. So in saying this, these are some of the things that one can learn about the coronavirus, and this is just an information to give you a brief introduction into what this disease and the pandemic contains. For any further questions, we'll take all these and discuss them in our Zoom session. Thank you for listening.